Hey guys, welcome to the Physio channel. My name is Daniel Lawrence. In this video, I'm going to show you some cupping techniques for sacroiliac joint pain. So I'm going to start off by placing 2 cups over the back of the sacrum. And then once they're in place, I'm going to gently move them in opposing directions. So one up and one down, and then reverse that, moving the other one up and the other one down. Moving slowly and up to the level of tissue resistance. These cups are really easy to apply. These are the silicone rock pods. Let me just show you. So to apply them, you press the top down, that deforms the pod, place it where you want it to go, release, and it then reforms and creates a level of vacuum. So very easy to apply. Once again, moving them slowly up and down, up to the level of tissue resistance. We can also just use 1 cup, stabilizing the pelvis and then mobilizing out laterally. If you push too hard, the cup will come off, but they're very easy to reapply. And this is often a very therapeutic direction to move out laterally over the pelvis and also slightly superior and also down towards the superior fibers of the glutes as well. You can relocate the pods onto the superior fibers of the glutes. That's often a very therapeutic place to place them. And have a look here, this lovely mobilizing technique around in circles, once again, up to the level of tissue resistance, is a really nice way to deliver a nice therapeutic input around the back of the pelvis. Can help offer some relief for sacroiliac joint pain. Here's another passive cupping technique you can try. You can actually place the pods directly over the back of the sacrum, and if you want to add some extra lift, some extra vacuum, then if you invert the pod, place it, then push the rim of the pod around so it flips back round, grabs a hold of the skin, and that creates a lot more vacuum up into the cup. Now, with a much more intense starting point, we can mobilize the soft tissue over the back of the sacrum, and once again this can give some significant relief from discomfort and pain over the SI joint. Also really good for lower back pain as well, so try it for that. Here I'm moving around in circles, but if there's one particular direction that the client finds helpful, then I can focus on mobilizing the soft tissue into that very direction. For the next technique, we're going to get the patient moving with some active cupping. So we'll go ahead and place the rock pods once again over the back of the pelvis, and then we're going to ask our client to come up into the stretch position. So if you come up onto all fours, please. From this kneeling position, ask your client to round their lower back, and then ask your client to drop their bum down to the heels to get a good stretch through the lower back. You can also do some active cupping over the lower back and over the sacrum from this position with your client flexing forwards. Let me show you how it's done. Use the vacuum created by one of the pods to lock the soft tissue over the back of the sacrum. You can mobilize the soft tissue there passively and then encourage the client to flex forwards whilst you mobilize the soft tissue. And then for some shearing, what you can do is as they flex forwards, you can see the pod starts to rise. You can actually lock that down, pushing it in the opposite direction, so pushing that down towards the couch as the client flexes away. And this will create some extra shearing up through the lumbar fascia here. And if you want to actually assist that movement, we can lift the pod up as they flex forwards, and this will pull the fascia over the sacrum up towards the lumbar spine and may help to increase the flexion during this treatment process. So once again, mobilize in that static position and then apply downward pressure as the client flexes forwards, return back to neutral, and then apply upward pressure as the client flexes forwards. Repeating those techniques 3 or 4 times usually gets some great results and helps to improve movement and reduce pain. I would also recommend some glide cupping over the back of the pelvis. Here I'm going to use some of the plastic valved cups, generate a little bit of vacuum, not too much, otherwise it will be really hard to get them to glide over the skin. And then from here, I'm going to move them out laterally over the top of the glutes, back, and then up towards the lumbar spine and back again. I'm just going to repeat that quick and easy routine. Because you're moving the cups, you don't get the circular markings that you get with static cupping. And for that reason, you can usually do glide cupping for a little bit longer, especially if the client is finding it very therapeutic and is enjoying it, then there's no reason why you can't keep going for longer. Just keep an eye on any skin abrasion. If you get any excessive reddening or erythema over the skin, then that would be an indication to stop the treatment so you don't cause any unnecessary skin irritation. I usually like to finish a session with these Rock Pod Vibes, which are silicone pods with vibrating modules on top. So go ahead and place one there over the back of the pelvis and another one right next to it. Switch those on and they're generating a high frequency vibration which is then resonating down through the pelvis, and once again can be really therapeutic and pain relieving if you have some discomfort through the sacroiliac joint. Thank you for watching the Physio channel. I have loads of other cupping videos on the channel, so check those out. I've also published a book on cupping, which is available on Amazon, and I teach courses as well. So if you'd like to find out more information, if it's not showing on the screen here, then please have a look in the description for this video. Thanks for watching. We'll see you in the next video.